watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, it's Friday. And man, do we have a couple of very special guests to introduce to you today. First of all, I want to welcome back to our show Dr. Naveen Gupta from ANP Foot and Ankle Clinic over in the Jordan Creek area. Dr. Naveen, great to see you again.
Same here.
All right, now we want to explain the type of specialty that Dr. Naveen Gupta has at ANP Foot and Ankle Clinic. Explain what you can do.
So one of the things we've been focusing on is chronic wounds, or the wounds that are very difficult to heal.
Okay.
And so, past few years we've been focusing on that aspect of the podiatry, or the, below the knee.
And that's what you specialize in, below the knee treatment.
Correct.
For chronic. And chronic are the ones that for some reason don't heal.
Right. Typically, they'll say anything that hasn't healed in 3 to 6 months becomes chronic.
Okay. And why don't wounds heal? What's some of the causes for wounds not healing?
There are a lot of things that can cause that. Circulation is one of the problems. Diabetes is another problem. Nutrition is another problem. Obesity is another problem that causes these wounds not to heal, or having excessive swelling because of the circulation problems that makes the skin stretch, and now the skin just can't get together.
Wow. But you had success. We're talking major success in treating these. And tell everybody how long you've been in practice, because this is very impressive.
We're going on 35 years now.
Wow.
Just finished 34. Wounds that we have seen, I've seen wounds that have been there for 6 years to 3 years or 12 years. Currently we're seeing a couple people that have been for several months, one 3 years old wound.
Okay.
And we're getting a good success with them.
Now let's talk about how important it is to get things treated and to get these wounds to heal, because you're hands-on. You really are. You are the guy they come to see, right?
That's right. Anybody that comes in, regardless what their problem is, I see everybody. Okay, they're not going to come see somebody else and go away. So I'm hands-on. They're going to.
And you speak their language. You don't speak doctorese, right?
That is right.
Okay.
I don't speak medical jargon, because I'm not talking to professionals. Occasionally, a professional comes in, but typically, it's better for me to explain in the plain English to someone who needs to understand what's going on. A lot of times things don't heal because person didn't understand what was going on with them. So we kind of, I try to get down into the nitty-gritty of, the things that are going on.
Yeah, and let's talk about how serious this is in some cases. Now, these numbers that you're going to hear are pretty staggering. So let's talk about people that have had like amputations and things like that, and the mortality rates that are that surround these. Explain that.
So there's typically, or from the numbers, there's about 150,000 amputations that happen in the country. About 40%, up to 40% of those people may pass away within 1 year, or up to 80% people die within 5 years.
And this is lower extremity amputation,
This is the lower extremity amputations. Level of the amputation could be below the knee, above the knee, at the knee level. But any amputations will result in mortality as much as up to 80% in 5 years.
Wow.
So it's very, very critical to get these wounds healed sooner than later.
And find out what you need personally to do to get the wounds to heal.
Exactly.
Okay, that's one of the most important things. Now, your practice is located in the Jordan Creek area, which is great, over on 68th Street. But we want to show a QR code here. You guys can zap this and get some more information. Scan that, take a picture of that, get more information, how you can get in, and you're going to see Dr. Naveen himself Okay, you are going to see the guy you see on TV now will be working on you to get your wounds healed. Is that correct?
That is correct. Yes, from the start to finish, you're going to see me. I'm
Okay.
going to be there doing whatever needs to be done for
That is so refreshing.
for your wounds.
Okay.
So you're not being delegated to whoever.
Okay, so you get to see the boss. That's the that's the important thing. The main guy.
I'm the working bee.
The worker bee. You get to see the main worker bee. Again, feetdr.com. Feetdr.com is the website if you want to go there and check everything out as well. Dr. Naveen Gupta, it is so great to see you again, sir.
Same here.
All right, great.
It's been a
Thank you so
pleasure.
much. And we're going to be visiting again with you and show you some more things of how they can really treat your foot and ankle problems and your wounds, get them healed, get healthy again, and just make life better, right?
That is correct.
That's a great idea.
Amputation is going to cause a lot of problems because now you're putting more pressure and more weight on the other leg, other foot, and that compromises that. And if you've got a poor circulation, the chances of having another amputation on the other leg is just as good.
Going to increase. So get a hold of Dr. Gupta, and he can take care of you. Now, we're going to take care of something else when we come back, folks. How about a little doggy that needs a brand new home from the Animal Rescue League of Iowa? You are going to meet Kingston when we come back.